Have you ever been stumped by a patient who asks you, should I get an MRI, or could you help me interpret the results? Well, in this video, I'm going to help you do that with confidence. My name is Dr. Garcia. I'm a leading expert in helping cash-based and sports-based physical therapists improve clinical outcomes and patient satisfaction. When people ask for MRIs, they don't know all the background that you and I have on how to deliver the information, what to do with it, do I need one, and how to interpret that. They want confidence if the MRI is going to tell them a different direction for their journey. And you as a physical therapist have to understand not just the medical side, but what it is the patient wants so you can do that properly and safely. The patient clearly doesn't want all the full impression of the MRI, axial injury to the paraspinals and all these other things. They just want to know, what does it mean for me? And most physical therapists do it improperly because they take the scientific route and they say that, if a patient asks you, should I get an MRI? First thing you say, well, there's studies out there that show 50% of people without back pain have, annular ligament tears, disc herniations and everything. You go from a scientific model, very logical. This patient over here is going very emotional. They don't know what to do, and it's the only thing they know. It's what their doctors have said, it's what their friends have said, it's their family, and all they're asking is this information, what other people are asking, the next route for me? And you go towards science and logically trying to beat their emotional response, and that doesn't work. So what you have to understand is, what does this customer want? What does this patient want? And then how do I service that? The patient is concerned. The fact that they need an MRI or want an MRI suggests that they're not happy with their outcomes and they're stuck and they're trying to look for that next solution. Maybe you're the physical therapist, it's your second, fourth, 10th visit, and they're not going in the direction you want. But an MRI is not going to change anything. So what you want to do is you want to meet them in the middle. Patient comes to you and says, should I get an MRI? Is this something that I need? I've been told by this. Before you go to that round of asking about, or telling about research, tell them or ask them, that's fantastic. If you get an MRI and it shows that you have significant injury to this area, would you continue with surgery or would you continue with conservative rehabilitation or other options? Most people would say, well, I don't want surgery. Okay, so the next question we have to ask is, why do we want this MRI? An MRI tells us if there's significant injury or not. What it'll then tell us is, are we going to go more aggressive to surgery? Are we going to stay on the conservative route? Most patients don't know this, and that's why it's important for you to ask them this. I've had a lot of physical therapists ask, what happens if I say they don't need an MRI and it's a significant injury and they do need surgery? I was wrong. You're not saying that you know definitively. All you're saying is most people who get an MRI who have injuries don't want surgery. So we're going to continue going this route. So then what does an MRI solve? An MRI solves the structural potential problem that then we have to decide how this forecasts or hurts or helps our projections on how fast this is going to heal. So if someone has a grade 2 rotator cuff tear that's hanging along by a thread, they can either go have surgery now or wait till that happens, or they might not be working on shoulder press for very long. All that does is it tells you, well, it doesn't tell you to stop, it just says, you might have to limit what you want to do unless you're going to have surgery. So you're probably going to have a 3 to 5 year forecast before that little thread just tears. For other people, it's, wow, I've been having back pain and the MRI shows nothing. Well, that's fantastic. The only reason that people get an MRI who don't want surgery is for peace of mind. All they want to know is, what is this and how long is this going to take to recover? You as a physical therapist don't have to take the research side of it. You just have to tell them and beat them to the punch that you understand what they're doing and ask them, what is this going to change in your course of care? Would you have surgery or get a cortisone injection? If this came out positive, well, no. Okay, so as you go into this MRI, understand, if you're not looking for surgery or cortisone injection, what it's going to tell us is what's happening at the structural level. And all that does is it changes maybe that we slow things down or be more aggressive, or it just puts you at ease that we're on the right direction. That's all people want. It's the clarity and direction that they are in the right path. That's why people choose MRIs. Not because they're looking for the research-backed information. They're just trying to figure out, what's the next step in my journey? Because the one I'm on right now, I'm not confident this is the one for me. And when you understand that, it helps patients be at ease, but physical therapists don't see that. because we're on the logical healthcare side and this patient is on the emotional patient side. And so in healthcare, you have to lead with empathy, have logic in that, but be able to communicate effectively. So if you're stuck of trying to figure out how do I deliver this message, okay, the best way to do is understand what the goal is and do they want that goal? If not, this is the route you're going to take. So if you don't want injections or surgery, that's fantastic for you. We're going to stay here. So no matter what the MRI says, you already know your routes, and that's all they want, so that when they receive that, they don't get the shock factor. Well, my PT said I didn't need this, and they said surgery is not needed for these type of things, and the surgeon says you definitely need it. You're never wrong in this scenario. If they said that they were interested in surgery and that's why the MRI wanted the MRI, why would you stop that? Support them along that process. Pick which path and allow them to know what path is, and that will help you as a sports PT instead of feeling like you're fumbling around or you're scared to say if they need surgery or not. Don't put yourself in that position. Just let them know what their options are and let them choose their own path. That will help you feel confident that you're doing the right thing for your patients and athletes. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.